And welcome to another Mark Bishop show. June, that's what we're in. Did you know it's Migraine and Headache Awareness Month? Very important month. Chronic migraines. I've got a friend that suffers from one murder, and maybe you do too. But additional preventive treatment is needed, and an option is now available. We're going to learn more about it and ways to help to prevent migraine. It's a debilitating disease that impacts nearly 40 million Americans. That's not a shy number, is it? So, with June being Migraine and Headache Awareness Month, an important time to raise awareness and learn more about migraine, debilitating neurological disease, including a recent FDA approval of an additional preventive treatment option for those living with chronic migraine. So we thought it'd be fitting to speak with a neurologist, a head specialist, about treatment options for migraine. And that's critical. Dr. Hope O'Brien, neurologist, founder and CEO of Headache Center of Hope. And we'll also be hearing from Kelsi Owens, who's a working mother living with episodic migraine. Welcome to you both, ladies.
Hi, thank you for having us.
Great to be here. Thank you.
Dr. O'Brien, if I can start with you, a very simple question. What is migraine, and what is the difference between episodic and chronic migraine?
A migraine is not just a headache. It's a complex neurological disease that involves recurrent attacks of moderate to severe head pain. When we think about a migraine, we think about a one-sided headache, but it can involve both sides of the head. The pain tends to be throbbing or pounding in nature, lasting on average anywhere between 4 to 72 hours. There are other symptoms associated with the pain. So patients will complain of light sensitivity, so they don't want to be in a bright room. Sound is also bothersome, so they want everything quiet. And patients may also feel nauseous and vomit. So it can be quite disabling, and it's actually the leading cause of disability in individuals under the age of 50.
No fun, is it? I mean, Kelsi, if I can ask you, how does your disease impact your life, personally and professionally for that matter?
Yeah, it really impacts every area of my life. I've been living with episodic migraine since I was about 6 years old, so almost 30 years now. And, personally, I'm a mom. I have a very active 7-year-old daughter, and, having to explain to her when I'm having a migraine attack that I can't do something seemingly very normal, like take her to the playground or get out of bed and make her a snack, is really difficult and sometimes even heartbreaking. Professionally, my team has to cover for me if I'm, need to step away on short notice, and, they end up rescheduling meetings or pushing deadlines or, taking on my workload for, an unforeseeable amount of time. And so it can be really difficult to manage.
So the thing can bob up anytime, too. It sounds like you've got to be extremely flexible in your life plan.
It is. It's hard to plan. You don't really know when you're going to have a migraine attack, and you don't really know how severe it's going to be until you're in the middle of it. So there's a constant fear, a constant dark cloud of when am I going to have another migraine attack, and what is that going to cause me to miss in my life? How long is it going to last? You're kind of struggling through, and you don't know when you're going to feel better. So, it really does a number on you.
There are so many things out there, and, this thing is sort of, I think, sometimes swept under the carpet and taken as, oh, look, I've got a headache, but it's not. It's so much more. Doctor, I'm going to ask you, Dr. O'Brien, what can you tell us then about preventive treatment options for people, like poor Kelsi as an example?
So it's an exciting time to be a headache specialist. And that's because the migraine treatment landscape has expanded or evolved over the last several years. And it's one of the reasons why Kelsi and I are here today partnering with AbbVie, the maker of QULIPTA, to raise awareness on an important milestone in migraine. When we talk about migraine, we can talk about frequency in terms of how often a patient is having symptoms. And so for patients who have episodic migraine, like Kelsi, that entails a frequency of anywhere between 0 to 14 headache days per month. And then in terms of chronic migraine, that is defined by having 15 or more headache days per month, with at least 8 of those days being impacted by migraine. And so QULIPTA is the only oral once daily medication in the class of CGRP antagonists that actually go to the root of where migraines start. It's FDA approved for the prevention treatment of both episodic and chronic migraine.
All right. So the word is QULIPTA, QULIPTA. QULIPTA, correct?
That is correct.
So it sounds like the Holy Grail, Dr. O'Brien.
Right. Well, it is. We're excited when QULIPTA received the indication for the preventive treatment of both episodic and chronic migraine. And what we've seen in clinical trials is that it's actually pretty well tolerated. The most common side effects are nausea, constipation, fatigue, and sleepiness. And in very few individuals, we can see a severe allergic reaction, especially in those who may be sensitive or allergic to QULIPTA and its ingredients. And so if we can see anaphylaxis may occur either the day that patients take the medication or it can occur days after. So it's really important to speak with your healthcare provider and talk about some of the other medications that patients may be taking in order to figure out if the QULIPTA is an appropriate treatment for them.
Well, the tradition has been people living with migraine, they have struggled to find a treatment that works for them. It's been a long time coming. And people with migraine, they really should talk with their doctor, as you say, about preventive treatment options too. So for more information on this particular thing, how would you like to express how, this can be found or bought or seen? What should people do?
Yeah, so people should talk with their doctor, talk with their healthcare provider, speak with their neurologist or headache specialist to see whether or not QULIPTA would be a good option. Or they can go to the QULIPTA website at QULIPTA.com, or they can call 1-855-QULIPTA. That's QULIPTA for more information.
Who comes up with these names for medicines? Tell me.
I mean, some well, I'll tell you, that's one of the easier ones.
They're tongue twisters, aren't they? QULIPTA. Oh, okay. Anyway, QULIPTA.com. Got it down? Hang on, Mark. I got to get a pen. All right, well, hurry up. Because everything's on the website. And you can have a good read and study, which you should do in your pajamas while you're having a cup of joe. QULIPTA, QULIPTA.com. Got it? Or the number is 1-855-QULIPTA. Well, I think this is great. It's good news, isn't it, really? Because there are so many people that suffer from this debilitating disease.
Absolutely. Like I said, it's a great time to be a headache specialist because now we can offer another tool that can help improve patients with migraines' lives.
Now, let's talk about quickly, we've got a minute or so. Tell me about you're the founder and the CEO of Headache Center of Hope. That's a nice name, isn't it?
Yeah. Well, there aren't too many places that exist for patients with migraine. As you know, it's quite debilitating. And so, if you need help, you want quick relief, you want to find somebody that you can access within days of having symptoms. So I created Headache Center of Hope as a center for individuals where the lights are dimmable, it's quiet, it's very spa-like, and patients can get an appropriate, correct diagnosis and get appropriate treatment.
Well, that's fabulous. Now, you're probably somewhere in the middle of America and people can't get to you unless they fly in, but they can probably call you, maybe, do a Zoom with you or something. You're there to help people, aren't you?
Oh, absolutely. They can go to my website or they can call my office number for more information. We see patients from all over the world, really.
Oh, fabulous. Okay, and your website address is what?
Yes, it's www.hcohcincy.com.
All right. Well, good luck. And you're doing a wonderful job. Keep it up, Angel of Mercy. Kelsi Owens, lovely speaking with you. I hope, you get a bit of relief. Life gets a bit better for you.
Thank you so much.
You're welcome.
Thank you so much for having me.
You're most welcome. Dr. O'Brien, lovely speaking with you, neurologist, founder and CEO of Headache Center of Hope on The Mark Bishop Show. Goodbye for now.
Thank you. Bye-bye.